Hello, my name is Brakoulias. I'm one of the psychiatrists in the Mental Health Centre. I'm also a senior lecturer with the University of Sydney. And today I'll be talking about critically appraising a research article. When I talk about critical appraisal, that basically means that we're looking at a research article and we're trying to work out if it's good or bad, or what the limitations of the study are, and what the positives of the study are. I guess I have a bit of extra knowledge in this area because I'm also an editor of a psychiatric journal, so I need to very quickly appraise articles to see whether they're good enough to be in a journal or not. So I hope in this video to give you a few little quick tips on how to look at an article and work out whether the article is good and whether it should be influencing the way we practice clinically, or whether we should be saying, I think this, we need to look at other articles, or we need more research in a certain area or topic. So critically appraising an article isn't very simple, but there are a few little tips that can help us look at an article and try to identify some of the problems in the article itself. There are different ways of critically appraising different types of articles. So if you look online, you'll see different guidelines for different types of papers. So for example, the PRISMA guidelines are well accepted in evaluating meta-analyses, and the CONSORT guidelines are well regarded for evaluating randomised control trials. But to keep it simple for this short talk, I'll give you some quick tips on how to review articles and to critically appraise them. The first step is to really understand what the paper is asking, what is the research question. And I think the simple PICO format is a very easy way of doing this. So when we use the PICO format, it refers to these things. P refers to the population that's being assessed. I refers to the intervention that's being used. C refers to the control group or the comparison group. And O refers to the outcome that's being assessed. And just to illustrate that further, I've just got a little example here. So in this example, P might be patients with schizophrenia. But it's important to try to work out from the paper what that specifically refers to. So it's good to look at whether they used a diagnostic interview to diagnose people with schizophrenia. So did they use the mini neuropsychiatric interview, for example, or the SCID? The I, the intervention, is looking at what's being investigated, what's the treatment or what's the intervention being investigated here. So it could be olanzapine, it could be some psychosocial intervention. But again, it's important that the intervention is described in detail so that you can understand what is being looked at exactly. So details about the dose, about the duration of treatment, etc. C is looking at the comparison group. So these people with schizophrenia treated with olanzapine, who are they being compared to? Are they being compared to people who are not receiving treatment? Are they being compared to people receiving haloperidol or another medication? And again, what are the specifics? What are the doses? Whereabouts in the treatment? How often are they receiving these treatments? And O is the outcome. So how are we objectively evaluating their outcome? So for example, are we using a scale to evaluate a reduction in the severity of their symptoms? Are we looking at PRN medication that's being used? And if so, how is that being assessed? So the hypothesis is basically the idea or the position that the authors are taking in the paper and what they hope to investigate. And it is very important that that's made very, very clear. Usually that's found at the end of the introduction paragraph. So I've tried to put together 10 steps as to what you can do, what you can look at when you're looking at a paper. So the first step is that very question. What is the question that's being asked by the paper, and what is it when you look at the PICO format? just to make sure that the paper has covered all of those 4 key components in the research. The second question is, what type of study is this? Is this a randomized control trial? Is it a case control study? That's very important because different studies answer different questions. The third step is, what are the characteristics of the sample? So you want to know whether the sample of patients studied in this paper are similar to your own patients or not. If they're not the same as your patients, you might not be interested in reading the paper further. What are the inclusion and exclusion criteria? So the sample of the patients might be too restrictive. You know, they might not include people with comorbid substance abuse or comorbid anxiety or depressive disorders. And you think, well, this doesn't really refer to my population. Or it might not be restrictive enough in that they don't have a clearly defined sample. So it's important to look at the inclusion and exclusion criteria. We also need to look at the intervention. And again, like I said before, whether it's specific and whether it has been randomized. And if it has been randomized, what is the method of randomization? And are you happy with how the sample was randomized? We then have to look at the control group and what that is and whether it's relevant, and whether the patients and the raters were blinded as to what they received. We need to ask whether the sample size was adequate. So if the study was only on 5 patients, we might think, well, that's not really very relevant. We want to see at least a study of 100 patients in this population in order to be satisfied that this result is true. We need to look at the tables, try to understand the tables, and make sure that they're clearly presented. If we don't understand the tables, then there could be something wrong. Maybe they're not giving the message clearly enough. We need to look at how precise the results are and whether the appropriate statistical tests were used. So that needs a little bit of knowledge of statistics, but with practice, you can build up that knowledge very quickly. And finally, we want to check whether the conclusions are justified by the results that are presented. So when the author says at the end, we feel that this medication is very beneficial with people with this disorder, was the study actually designed, or did the study present enough results for them to be able to say that statement confidently? And the final question that we always ask ourselves is whether these results are actually clinically relevant, and more specifically, whether the results will change my clinical practice. That's a very, very important question, which we always end with when we're evaluating articles in our journal clubs, because we want to make some sort of conclusion as to whether we have to change our practice based on the paper that we've just read. Thank you very much.